guys, I am Annie, your friendly health coach. Welcome to my page. In today's video, we are going to talk about heart attack. You can follow my health and well-being on all social media platforms if this is your first time on my page. You may be wondering what a heart attack is and why it occurs. Stay still and I will explain. A heart attack occurs when something blocks the blood flow to your heart, so it can't get the oxygen it needs. It's a medical emergency. Call the emergency right away. At the first sign of any symptoms, don't wait to see if the symptoms pass. To work properly, your heart needs a continuous supply of blood. It normally receives this from blood vessels called coronary arteries. When a coronary artery suddenly becomes blocked, oxygen can't get to your heart muscle. This causes a heart attack, or what we call myocardial infarction. According to the World Health Organization, cardiovascular diseases are the most common cause of death globally. In 2019, an estimated 17.9 million people died from cardiovascular diseases, accounting for 32% of all deaths worldwide. Of these deaths, 85% were due to heart attacks and strokes. I will now give you the symptoms of a heart attack. Symptoms like you have a feeling of discomfort, pressure, heaviness, tightness, squeezing of pain in your chest, arm or below your breastbone, discomfort that goes into your back, your jaw, your throat, or even your arm. You also experience fullness, indigestion, or a choking feeling. It may feel like heartburn, sweating, upset stomach, vomiting, or even dizziness, serious weakness, anxiety, fatigue, or shortness of breath. You also experience fast or uneven heartbeat, or what we call heart palpitations. Heart attack symptoms can be different from person to person or from one heart attack to another. Women and people assigned female at birth are more likely to have this heart attack symptoms like unusual fatigue, shortness of breath, nausea or vomiting, dizziness. You also experience discomfort in your gut, or you may feel like indigestion, discomfort in your neck, your shoulder, or even the upper back, trouble sleeping. With some heart attacks, you won't notice any symptoms at all. We call it a silent myocardial infarction. This is more common in people who have diabetes. Let me explain to you what a heart attack feels like. A heart attack feels like intense chest pain, the kind where someone is squeezing your chest really hard, or you are carrying a heavy weight on it. You could have this pain for a bit. You might also feel weak, dizzy, or like you are going to pass out, and you could start sweating a lot. Sometimes you also have a mild pain in your jaw, neck, back, or arms. Plus, you may have trouble breathing. Are you familiar with the causes of heart attacks? The most common cause of a heart attack is coronary artery disease. This is where fatty deposits, cholesterol, and other substances build up in the walls of your coronary arteries that supply oxygen to your heart. Over time, this buildup hardens into cholesterol plaques. The plaque can rupture or burst and cause a blood clot, which blocks your artery. In some cases, heart attacks have another cause, like coronary artery spasm or variant angina, which is unusual narrowing of your blood vessels that can stop blood flow to your heart. We also have a spontaneous coronary artery dissection. It's a sudden tear in the wall of your coronary artery. Certain lifestyle factors are also shown to increase your chances of having a heart attack. This include smoking, unhealthy diet high in saturated fat, salt, and added sugar, not getting enough physical activity, having high blood pressure, having high cholesterol, having diabetes, being overweight or even obese. See your doctor regularly to manage your health. Your doctor can test for heart disease risk factors and help you take steps to prevent a heart attack. So how are heart attacks diagnosed? If you think you might be having a heart attack, you need immediate assessment in hospital. There, a doctor will assess your symptoms and check your vital signs, including your blood pressure, pulse, and temperature. And now the question is, how can you prevent a heart attack? By making a positive lifestyle changes is the best way to lower your risk of a heart attack. There are a number of ways you can improve your heart health, like such as quitting smoking, eating a healthy diet, seeing your doctor to help manage your cholesterol and blood pressure, staying physically active and exercising regularly, maintaining a healthy weight, drinking alcohol in moderation or not at all, reducing stress, and looking after your mental well-being. There are also other risk factors that you can't control, like your age, sex, ethnicity, and family history. Speak with your doctor if you are concerned about your risk factors. They can give you tips on how you can reduce your risk of a heart attack. Complications following a heart attack can be serious. Some complications include arrhythmias, like your heart may develop an abnormal heartbeat following a heart attack due to your damaged heart muscle disrupting electrical signals. And also, the second one is heart failure. Your heart may have difficulty pumping enough blood due to the muscles being too weak or too stiff. And also, we have cardiogenic shock, which is a life-threatening condition where your heart suddenly can't pump enough blood to your body. And another one is heart rupture. This is a real but serious complication in which your heart muscles, walls, or valves split apart. If your question is a cardiac arrest the same thing as a heart attack? Wait, I'll explain that to you. A cardiac arrest and a heart attack are both medical emergencies. However, they are not the same thing. During a cardiac arrest, the electrical system that controls your heart and rhythm stops working properly, and your heart stops breathing. Someone having a cardiac arrest will collapse and have no pulse. They may not even breathe properly or not at all, and they will lose consciousness. If someone has a cardiac arrest, they need help immediately. Call for an ambulance immediately. While waiting for the ambulance to arrive, begin chest compressions or CRP. Use a device called defibrillator if available. Sometimes a heart attack can progress into a cardiac arrest. Recovering from a heart attack can be both emotionally and physically challenging. Hearing stories from others who have experienced a heart attack can help. Call for emergency medical help if you think you are having a heart attack. If you don't have access to emergency medical services, have someone drive you to the nearest hospital. Drive yourself only if there are no other options. In all my videos, I will focus on symptoms, causes, and prevention. I'll not focus on treatment unless it is necessary to do so, because the disease I have talked about can be treated in the hospital and not at home. So always consult your doctor for your treatment. Remember to take good care of yourself, and if you have any concerns, call your doctor. Thank you for watching, and please don't forget to like and share my page if you like this video. Thanks and hey.